So let's talk about PCAs. So we're going to pretend like we are changing caregivers and we need to clear out this pump and then put our data into the patient's chart correctly. So the first thing to note is what is on the home screen of the brain, and it shows the VTBI, or the volume to be infused, is 23.5. So that is what is left in the syringe. You want to then hit this volume infused to see what's been administered to the patient since you last cleared it. So pump C is the PCA, and 1.16 mils has been administered to the patient. You're going to clear that channel, and then you want to go find out the actual history of the PCA. So you hit channel select, options, patient history, and go ahead and zoom out all the way 24 hours, and you'll see the total drug. The total drug is in milligrams, so we ignore that because nowhere are we charting anything in milligrams. But the amount of times the patient has pressed the pump is 18 times, but they only got it administered to them once. So once you make note of all of that, you're going to clear the history, exit, and then restart the PCA. And then you're going to take what you just wrote down and go to the patient's chart. So when you go to the patient's chart under the I&O/INET, you go to Nursing Division, Vitals, and ADLs, and you'll find this PCA. So the PCA has already been programmed, so it's a low dose, so it's a 0.2 milligrams per mil, and we're going to chart. So they are getting both continuous and demand dose. For this patient, they are getting the 0.2 continuous, no bolus, and then 0.2 milligrams. They can have that every 10 minutes for a max of 1.4 milligrams. So the patient pushed it 18 times. They got one actually given, and then the VTBI, or the volume to be infused, will go here. So that was the 23.5. And then the patient will always have their CO2 monitor on. You don't need to change the tubing unless it's been 96 hours. We're going to change the caregiver, do all the things, and then you would sign off and have a second nurse do that. But then you're going to go to the MAR, and you're going to find the PCA under the continuous infusions, and you're going to click on this because we're going to chart how much was actually infused. So this is where the 1.16 that we got off of the home of the brain, you're going to put it there and then hit apply and save that. So that shows that 1.16 mils was administered to the patient. And that's all.